Welcome everybody. My name is Sherry Stoka, and today I'm going to talk in more detail about our MRT food sensitivity test and really help you better understand diet-induced inflammation and symptoms. And really the reason for this presentation is that many of our clients want to know what foods they have problems with. And it's easy to get a printout of foods that you're reactive to, foods that you're not reactive to, but until you fully understand what is happening in the body, that's when you can really be empowered to really make the changes and reduce chronic disease progression. So the learning objectives for this presentation is to define inflammation and its role in acute and chronic illness, learn how food induces inflammation and its effect on certain disease states, compare 3 different types of diet-induced inflammatory responses, and then we are going to review my report so that you have a better understanding when you are reviewing your report as well. So this is just a snapshot of the effects of diet-induced inflammation. Every disease starts with an inflammatory process, and therefore any type of inflammation could be tied to any disease state. So we will come back to this, but it just gives you an idea that it truly does affect your health in a more significant way. So what is inflammation? We have 2 different types of inflammation, acute and chronic. Acute is very natural and it's essential to human life. So if you think about it, when you break your leg or you burn yourself, you have an inflammatory response. Inflammation starts the healing process. You're starting to get blood flow to the area, nutrients will go to the area, and then you will start to repair the injury and heal. So that is a very normal part of human health. Then we have chronic inflammation. So this is inflammation that really never turns off. So it's chronic in nature, it's long-term, and it's very damaging to the body. So this is where I had just mentioned that disease and illness can set in, and it can have a significant impact on your quality of life. So again, inflammation is the root cause of all chronic illness. That's very, very important to understand. You can see here, it's the foundation to any type of disease that you are basically prone to get, based on your genetics, based on other lifestyle factors and other things that are related to your health. Inflammation will start that process. There are 3 categories of diet-induced inflammation. There's food allergy, autoimmune, and then there's food sensitivity, which we'll talk in more detail about. I first wanted to start by just briefly helping you understand our immune response. So we have an innate immune response, which is essentially the first line of defense against external pathogens, or what we call, non-specific immune response. So this consists of physical, chemical, and cellular defenses against pathogens. So we are exposed to pathogens at every single day, all day. Our immune system is always working for us. So the first to respond is, again, this innate immune response. The main purpose is to immediately prevent any spread or movement of foreign pathogens throughout the body. So then we have a secondary defense called adaptive immune response. And this is referred to as acquired or specific immunity. And the adaptive response is specific to the pathogen presented. So it's meant to attack the non-self pathogens. So again, maybe like external things that are coming in. So it's the second line of defense if your immune system fails from the innate perspective, so then adaptive could set in. But with the adaptive immune response, this is where there could be errors in identifying what is actually foreign and what is actually not. So this is when autoimmune diseases can develop, because now the immune system is attacking our own body. So examples of that would be lupus, rheumatoid arthritis, Hashimoto's, MS. There are so many. And this area, autoimmunity, is literally a pandemic. And it's all tied together with the gut, food sensitivities, etc. So the mechanism, food sensitivity mechanism, innate to adaptive. So essentially, if you can like kind of grasp this image here, let's pretend that this, you can see this as the epithelial lining of the gut. So believe it or not, you know, if you think of our digestive tract and how it's protected from the outside world to what's, you know, into circulation, it literally is one cellular layer thick. And it is a very tight, strong layer. So it is meant to keep everything out that is not supposed to be in our circulatory system. So this is our gut lining. Over time, because of the abuse and because of all of the things that we are exposed to, we start to become inflamed. These tight junctions begin to open up a little bit, as you can see here. And when they begin to open up, this is when the antigens can slip through the gut lining. When antigens or parasites, yeast, toxins, anything like that slips through, that's where our immune system sits. We have many different immune cells that sit there waiting to attack so that basically we're protected. So you can see here that there are many complexities to this, but we do have backup, you know, within our body and our immune system. But where this all starts to go in the wrong direction and falter is really this epithelial cellular layer that begins to really break apart. So a food allergy, most people are familiar with a food allergy. It's relatively easy to diagnose. This is a very quick symptom onset for people that are experiencing allergies. Typically, they have consistent symptoms, and this is not dose dependent, typically based on the allergen. So these are common allergens in our diet. Most people are pretty familiar with that. Food allergies can be fatal. And this is literally when the body goes into shock, trying desperately to get rid of what they perceive to be, you know, as foreign. So symptoms of a food allergy can be swelling, itching of the lips or tongue. You have breathing problems, you start to cramp, vomit, you have diarrhea, or you start to develop hives, rash, or eczema. Now, food sensitivity is different than a food allergy. So this is important to understand. They both involve an inflammatory response. They both involve the immune system, but the immune pathways are different. So food sensitivity, the symptoms are typically what you see here: migraines, itching or tingling, nasal congestion, skin rash, acne, bloating, nasal drip, brain fog. These are typically not like life-threatening, whereas the allergies can be life-threatening. Just some examples of diet-induced autoimmune reactions. So celiac disease, dermatitis, type 1 diabetes, Hashimoto's, lupus, MS, myositis, reactive arthritis, rheumatoid arthritis, and there's so many more. But it is, again, just important to understand that when the gut is compromised, now the immune system is confused and the immune system begins to attack certain parts of our body. And that's when you see these diseases start to set in. Celiac disease, everyone hears about this all the time, you know, the gluten-free basically has taken over the food market. So it's important to understand a few things about celiac, because I think we kind of we're taught in a very narrow-minded fashion that celiac is just about the gluten, and it's just not. So important things to note is that it's often misdiagnosed. The testing is not great, but you know, and when you are doing the testing, there's certain things that you need to do prior, and one of that is definitely consuming gluten for testing, because you want to avoid any false negative tests. Symptoms are usually more severe. So you can see here chronic diarrhea, constipation, unexplained weight loss, iron deficiency, anemia, extreme fatigue, joint pain, tingling, depression, anxiety, seizures, etc. So this is taking the symptoms to definitely the next level. Celiac disease is an autoimmune reaction that is caused by, again, your propensity to develop this disease, plus the presence of gluten. So again, what happens here is that the immune system is confused, so that adaptive response is confused, so it begins to attack its own tissues. And the main part of the gut or the digestive tract that is affected is the microvilli, which I will kind of explain, but I don't think it's that important right now, and the skin. And oftentimes it's not dose dependent. If you have celiac disease, even a small spectacle can cause a reaction. So strict avoidance of all gluten is critical. And these are certain grains that literally need to be removed. And also when somebody does have celiac, I mean, they're usually working with somebody who is very specialized in this area, because you have to know where all of the sources could be coming from. And it's important to understand that celiacs often, very often, have comorbid food sensitivities because their guts are so compromised. So again, this just gives you a snapshot of what happens when the gut becomes compromised, or what we refer to as like a permeable or leaky gut. So this is a healthy gut, right? This is the intestinal lining. These are tight, nothing's getting in. Over time, what happens? Inflammation sets in, these junctions begin to separate, and now it's free will of all sorts of particles and pathogens, and larger food particles are getting in to circulation. And then that's when it's starting that cascade, and the immune system sits here. So again, it just gives you another look at why the gut and healing the gut is crucial. So now we'll talk a little bit more about the food sensitivities in more detail. So again, this is what we know. Food sensitivities are tied to all sorts of inflammatory diseases, which is basically almost every single disease known to man today. Food sensitivities versus, again, food allergies. Sensitivities are challenging for many reasons, because they're involved in many conditions and they have a range of symptoms. Many reactive foods and food chemicals are involved. It's much more than just gluten and dairy. We're talking about gluten and dairy all the time, but it could literally be the healthy foods that you're eating, the salmon, turmeric, spinach, etc. So it's not just about the unhealthy food. It's hard to identify food sensitivity triggers because it's dose dependent. So a small amount may not provoke any reaction, but if you eat too much, it may. So another piece is delayed symptom onset. So for a food allergy, you're getting an immediate response, and food sensitivity could be up to 48 hours, and then your body responds with symptoms. So this is why testing is crucial. And again, we're talking about the MRT test, mediator release test. It really is considered the best, one of the best ones on the market. So another snapshot of how food sensitivities cause inflammation. So I'm not going to go over this in greater detail, but you do have the triggers, so the antigens, the chemicals. Then you have the cellular activation of our immune cells, and then our body begins to release these mediators. And that's essentially what we're testing for, certain mediators that are affected by the food antigens. And the pathophysiologic effects in the body: inflammation, tissue damage, pain receptor activation, smooth muscle contraction, edema, excess mucus, neurological issues, and increased gut permeability. So again, just another way to look at how this whole complex, this cascade, relates to all of these main inflammatory diseases. So it's important to note that symptoms that a person experiences really does depend on various things. So one could be your total inflammatory load at the time. So that could mean many different things that is causing inflammation in your body. You know, your stress load at the time of reaction, your genetic predisposition, again, your total antigen load, which could be, again, all the different foods that you're consuming. Which cells react with mediators are released? Where in the body the reaction takes place also varies as well. And also the current condition of your body and your gut and digestive health. This is all going to play a huge role in the type of symptoms and the severity of the symptoms. So again, these are just different types of inflammatory stressors on the body. So food sensitivities, inhalant allergies, food allergies, chemical and toxins, hormonal stressors, emotional stressors, nutritional stressors, infectious stressors, etc. So obviously, we want to make sure that we're limiting that as much as possible. Okay, so we'll talk a little bit more about the MRT test, and it is considered one of the best, food sensitivity tests on the market. It's only blood test that gives insight into the innate and adaptive mechanisms. So it accounts for most inflammatory pathways. It quantifies the inflammatory reactions, and it's the only test that accounts for dose-dependent reactions as well. So it has excellent reliability, and its highest clinical utility of, again, any of those food tests, other sensitivity tests out there, because there's a lot. And this test is not cheap, and that is the reason why. So I'm going to take you through briefly my tests. This is one of my tests. I've done several. And so obviously, the more reactive you are to certain foods would indicate how healthy your gut is, because foods become a problem when your gut is out of balance or compromised. So in the MRT test, it is divided up into different categories. And I'll kind of go through briefly, but as you can see here, it's going to give you results that look at non-reactive chemicals, foods, mildly reactive, and very reactive. So in this particular category, we're looking at chemicals, and I know it's hard to read all the specific ones, but these are certain, the ones in yellow are moderately reactive. Vegetables, so for me, I had 3, which looks like scallions, tomato, and corn. Corn seems to be a very common one for most people because corn is very genetically modified, it's processed, and it's in a lot of stuff. We don't do well with that. And another category is beans, nuts, legumes, seeds. So for me was almonds and sunflower seed. Fruits, I was fine with all the fruits. And then we have flavor enhancers, which mine was mint here, meat and poultry, so turkey, and that looks like chicken. Okay, I'm gonna have to do this again because I eat a lot of chicken. So, and then you look at your grains, and for me, wheat was elevated. And when you do this test and when you are looking at your results, please again understand that this is not an allergy test. This is a food sensitivity test. So if you have celiac and wheat shows up normal on yours, which that's very uncommon, but if it does, it's because this is looking at mediators. It's not looking for that allergic reaction. And anyone with a compromised gut essentially needs to be off of gluten anyway. So then we have miscellaneous, which is some of the beverages, coffee, teas, brewers, yeast, etc. Mine were all fine there. This section here is seafood. So I had some that I need to stay away from. And then there's the dairy section. So I know that I don't do well with dairy. I haven't eaten dairy in a while, but this is a section that can be very confusing. And I am going to talk a little bit more about that in more detail, but please understand that if you are doing this test and you have, whether you have yellow, red, or green in your dairy, we are eliminating dairy for at least 14 days because it is a complex category, and it has a lot to do with where the food source is coming from. And dairy is one of the most inflammatory foods to the human body, and it also can be mistaken for gluten by our immune system. So there's various reasons, and like I said, I will talk in more detail about that. So another nice thing about the MRT test is that you will be given a very structured plan that includes 5 different phases. And essentially in each phase, you are going to be eating the foods that are laid out for you exactly as they look right here. So phase 1, for the first 7 days, I would only be eating these foods. So I have to concoct a meal plan that only includes these foods. Phase 2, which is days 8 through 12, I can now add all of these foods to phase 1. So that's a lot more options. And then you can see phase 3, you're adding all of these, phase 4, and then you get to phase 5, which is slightly different. You're doing more of a kind of rotation and starting to cycle foods and add foods back in to see how you respond. But for the first 4 phases, which is approximately 22 days, you're really eating the foods that are laid out. And how this is really determined is phase 1 foods are obviously your lowest reactive foods. Phase 2 would be, more of like the higher greens or the middle to higher greens. And then phase 3 and 4 would be your higher greens. So the ones that are closer to the moderately reactive. So it's set up so that you obviously are only eating the lowest to begin with. This page here actually puts a numerical to the reactive, the reaction to the food, the actual food. So you can see phase 1, all of these items that are listed here, they have this numerical. And what might be confusing for people is that in phase 2, you may have some numericals that are actually lower than phase 1. So what I tell my patients is that if your phase 1, the first week is so restricted, you can actually go to phase 2 foods if the foods are 1.0 or less. So it just really helps with adding, really making the diet more doable. So hopefully that makes sense. And again, you can see as you go further down the phases, the numericals are higher. Okay, some important tips to keep in mind. Hygiene. So oral symptoms such as coughing, sore throat, sore tongue, choking, skin issues could be a result of, the skin products that you're using, mouthwash, toothpaste. So don't always think about just food. It could be anything that is going into your body. So you really want to check, your lotions, your shampoos, etc. If you are reactive to coconut, so if coconut shows high on your list, you want to look for items that contain sodium lauryl sulfate. So this is common. And this does contain the coconut derivative. So you may be reacting to that. Many dyes may be in pills, supplements, products. So you really, really want to look and read labels as much as possible and think beyond, just looking on the labels of like processed foods, because, even like this, for example, the grilled chicken at Chick-fil-A had dyes blue number 1 and yellow number 6. So again, just be diligent if you have yellows and reds on your test. Also, medications and supplements should be reviewed for all reactive ingredients. Migraines. If you're someone who suffers from migraines, you'll want to avoid tyramine and phenylethylamine, which is something that is above and beyond what your results are, because tyramine does get a little tricky in how it can be produced in foods. So, just keep this in mind or ask us in more detail if you are someone who's suffering from migraines. And just in general, you'll want to remove cocoa, aged cheeses, fermented, smoked, pickled foods until your symptoms improve. Okay, so a little bit more about dairy. Across the board, like I said, regardless of your reaction level, you're going to be avoiding dairy for 10, 14 days. Keep in mind, we don't test for the milk allergy, IgE. So this is looking at mediators and how you are reacting. This is not a test for lactose intolerance either. So some people might have lactose intolerance and basically think that, if it doesn't show reactive on this test, but they know they have, a sensitivity to dairy, that could be because it is a lactose intolerance and not actually a mediator response. It's also important to note that antigens can transfer through breast milk, so AKA udder milk. So if a cow is eating corn, grass, or whatever else they are feeding these cows, that could be passed on to the person that is consuming the cow's diet, essentially. Butter, a lot of people ask about butter. It may be allowed if you don't have any allergy symptoms, so none of the respiratory, hay fever, runny nose, etc. But just be very aware when you're eating butter. If you start to feel that if you're not, you're having a response to that, then you want to exclude that as well. And if you're excluding regular butter, ghee is also not going to be allowed. So some freebies: distilled water or distilled white vinegar, baking soda, and sea salt are tolerated by most clients. You can have carbonated water. You can add or mix that with some type of allowed juice. Baking powder, keep in mind, often has corn. So caution if corn is reactive for you. You can always make your own baking powder at home if you wish. There's many recipes on the internet. Hydration. Hydration is very, very, very important when you are eliminating your inflammatory foods. You know, when you're eating inflammatory foods for so long, you start to retain water. That's kind of what inflammation does. So when you start to remove those foods, you will flush a lot of water. So make sure that you are replacing that water. This could be broths, some homemade electrolyte solution, or some type of electrolyte drops, which again could be easily made from like coconut water, a pinch of salt, honey, lemon, etc. And as you flush this water, this process could take about 10 days. And some people do experience dehydration. So just pay attention to the dehydration. You can see here constipation, cramping, dizziness, etc. But that can be easily reversed by replacing with electrolytes. So that's about it. So just in summary, with all of your test results, you're going to get a very comprehensive booklet that that's provided for each test. Also, you don't want to focus on the individual foods on the test. Really focus on the phased process that I reviewed. Always listen to your body. If something is green on your result, but you know every time you eat it, you don't feel right, well, then you don't want to continue to eat that food. And really the goal is to heal, to add certain foods back in and regain your health. You know, this is not about, avoiding these foods for the rest of your life. We are doing this because we want to remove the insults to the gut, heal the gut so that, your diet can be more diverse and you don't have symptoms when you eat. So hopefully that's helpful.